Hey Tony. How are you doing today? Why are you wearing a bloody apron to clinical?
Oh. I just had a little fight with my wife this morning, but we worked it out. Thanks for asking, Gabe. What type of surgery are we going to watch today?
This is a coronary artery bypass graft. You idiot.
Oh yeah. Sorry about that.
That's okay. I think we should create an animation for our presentation on spiritual care. Do you think that is a good idea?
That's a great idea, Gabe. I just wish I was smart enough to have thought of that first. I probably could not do it though, even if I tried.
That's okay. I'm sure your wife still loves you. Maybe we can talk about that experience you had with the Native American patient last week.
Yeah, maybe. She was a 54-year-old woman from the reservation and she had never been to a hospital before.
She had just been diagnosed with diabetes, right?
Yeah, she spoke little English but appeared to understand what was being said to her. She followed instructions well, smiled, and did not ask many questions. The next morning she was preparing to leave because she needed to care for her family who lived 2 hours away. I brought her insulin and other medications to her and explained her new regimen. She smiled and nodded but refused to take them. She said that she needed to say her prayers.
Well, that is odd.
So I gave her some time to pray and came back later. When I returned she gave me the same response. So I was confused.
So maybe we can emphasize the importance of assessing the patient's understanding by asking them to verbally repeat what the plan is and how the medications help them. It may be helpful for nurses to describe the medications to the patient as being a supportive measure and that it does not replace their beliefs. This way you are indicating that their belief is most important to their recovery and that we are not just pushing our beliefs on them. Regaining balance and harmony with their environment is often what they believe leads to recovery and health.
I think it would have been a good idea to request a translator as well prior to giving instructions and care to her. Because with such a culture boundary it may not be just words that need to be translated but ideas as well.
That's true. While she may have understood what you wanted her to do, it might have been against her beliefs, or maybe, if the plan was stated in a more appropriate manner culturally, she may have complied.
While providing care, it is good to be aware of nursing diagnoses like spiritual distress, as well as other cultural issues such as harmony and balance with nature, when dealing with Native American patients.
Native Americans may deal with pain and loss differently as well. It would not be surprising to not see a Native American cry or express any type of emotion with the loss of a family member or even bad news regarding their own health or future. They can be very stoic. A patient I had one time refused pain medications after 2 large wound vacs were placed. I could tell he was in pain by his movements and mannerisms, even though he was trying not to let it show. I asked if I could give him the pain medications because I wanted to, and not because he was in pain. He agreed when it was phrased that way.
In our presentation we should try to find a way to incorporate the fact that because of their history, natives may be reluctant to participate in our way of medicine. With that said, nurses should present new ideas tactfully, while attempting to adapt our medical care to their set of beliefs.
Medicine men and healers are often relied upon in their culture. They should be incorporated into the patient's care if it will be nurturing to the patient and promote recovery.
What in the world was that?
That was like a Native American rain dance or something. Wasn't it obvious?
That was kind of awkward and made me feel uncomfortable. However, it was actually a really good dance, Gabe. Do you think you can teach me those moves sometime?
Sure.
Well, now that we pretty much know what to say in the presentation, we need to find a way to tie it all together.